Good day, this is Professor Will, CBMD PhD. Today is Sunday, May 10th, 2020. It is 5:22 and 33 seconds p.m. Eastern Standard Time. And this is my second video on Corona series of the day. So let's get started here. Mutations in SARS-CoV-2 offer insights into virus evolution. Date May 5th, 2020. Source University College of London. Summary. By analyzing virus genomes from over 7,500 people infected with COVID-19, researchers have characterized patterns of diversity of SARS-CoV-2 virus genome, offering clues to direct drugs and vaccine targets. The study identified close to 200 recurrent genetic mutations in the virus, highlighting how it may be adapting and evolving to its human host. Researchers found that a large proportion of the global genetic diversity of SARS-CoV-2 is found in all hardest-hit countries, suggesting extensive global transmission from early on the epidemic and the absence of single patient zeros in most countries. The findings published today in Infection, Genetics, and Evolution also further established the virus only emerged recently in late 2019 before quickly spreading across the globe. Scientists analyzed the emergence of genomic diversity in SARS-CoV-2, the new coronavirus causing COVID-19, by screening genomes of over 7,500 viruses from infected patients around the globe. They identified 198 mutations that appear to have independently occurred more than once, which may hold clues to how the virus is adapting. All viruses naturally mutate. Mutations in themselves are not a bad thing, and there is nothing to suggest SARS-CoV-2 is mutating faster or slower than expected. So far, we cannot say whether SARS-CoV-2 is becoming more or less lethal and contagious. The small genetic changes or mutations identified were not evenly distributed across the virus genome. As some parts of the genome had very few mutations, the researchers say those invariant parts of the virus could be better targets for drug and vaccine development. A major challenge to defeating viruses is that a vaccine or drug might no longer be effective if the virus has mutated. If we focus our efforts on parts of the virus that are less likely to mutate, we have a better chance of developing drugs that will be effective in the long run. We need to develop drugs and vaccines that cannot be easily evaded by the virus. There are still very few genetic differences or mutations between viruses. We found that some of these differences have occurred multiple times, independently of one another during the course of the pandemic. We need to continue to monitor these as more genomes become available and conduct research to understand exactly what they do. The results add to a growing body of evidence that SARS-CoV-2 viruses share a common ancestor from late 2019. Suggesting that this was when the virus jumped from a previous animal host into people. This means it is most unlikely the virus causing COVID-19 was in human circulation for long before it was first detected. In many countries, including the UK, the diversity of viruses sampled was almost as much as seen across the whole world, meaning the virus entered the UK numerous times independently rather than via any one index case. The research team have developed a new interactive open-source online application that researchers across the globe can also review the virus genomes and apply similar approaches to better understand its evolution. Being able to analyze such an extraordinary number of virus genomes within the first few months of the pandemic could be invaluable to drug development efforts and showcases how far genomic research has come even within the last decade. We are all benefiting from a tremendous effort by hundreds of researchers globally who have been sequencing virus genomes and making them available online. Blood thinners may improve survival among hospitalized COVID-19 patients. Research could change standard of care protocols to prevent clotting associated with coronavirus. Date May 7, 2020. Source Mount Sinai Hospital, Mount Sinai School of Medicine. Summary. Treating hospitalized COVID-19 patients with anticoagulants, blood thinners that slow down clotting, may improve their chances of survival, researchers report. The study could provide new insight on how to treat and manage coronavirus patients once they are admitted to the hospital. The study found that hospitalized COVID-19 patients treated with anticoagulants had improved outcomes both in and out of the intensive care unit setting. The research also showed that the difference in bleeding events among patients treated with and without anticoagulants was not significant. The Mount Sinai researchers say their work outlines an important therapeutic pathway for COVID-19 patients. This research demonstrates anticoagulants taken orally, subcutaneously, or intravenously may play a major role in caring for COVID-19 patients, and these may prevent possible deadly events associated with coronavirus, including heart attack, stroke, and pulmonary embolism. Using anticoagulants should be considered when patients get admitted to ER and have tested positive for COVID-19 to possibly improve outcomes. However, each case should be evaluated and individualized basis for accounts for potential bleeding risk. Mount Sinai researchers show that a large number of patients hospitalized with COVID-19 have developed high levels of life-threatening blood clots, leading to potentially deadly thromboembolic events. A team of investigators evaluated records of 2,773 confirmed COVID-19 positive patients admitted to 5 hospitals in Mount Sinai Health System in New York City. They specifically looked at survival rates for patients placed on blood thinners versus those not placed on blood thinners. The researchers took certain risk factors into account before evaluating the effectiveness of anticoagulation, including age, ethnicity, pre-existing conditions, and those already on blood thinners. Of the COVID-19 patients analyzed, 786, 28% received a full treatment dose of anticoagulants, a higher dose than what is typically given for blood clot prevention, and one that is usually given to those who already have clots or are suspected to have clots. Treatment with anticoagulants was associated with improved hospital survival among COVID-19 patients, both in and out of the intensive care unit setting. Of the patients who did not survive, those on anticoagulants died after spending an average of 21 days in the hospital, compared to the non-anticoagulant patients who died after an average of 14 days in the hospital. The effect of anticoagulation had a more pronounced effect on ventilated patients. 62.7% of intubated patients who were not treated with anticoagulations died, compared to 29.1% of intubated patients treated with anticoagulants. Of the intubated patients who did not survive, those with no anticoagulants died after 9 days, while those on anticoagulants died after 21 days. All patients in the study had blood work done when they arrived at the hospital, which included measuring various inflammatory markers. The analysis of their records showed patients who received anticoagulants had higher inflammatory markers compared to patients not treated with anticoagulants. This may suggest patients with more severe illness may benefit from anticoagulants early on. The observational study also explored the association of systemic anticoagulant treatment with bleeding events. Major bleeding was defined as 1. Hemoglobin greater than 7 GDL and any red blood cell transfusion. 2. At least 2 units of red blood cell transfusion with 48 hours, or 3. A diagnosis code for major bleeding including intracranial hemorrhage, hematemesis melena, peptic ulcer, hemorrhage colon rectal, anal hemorrhage, hematura, ocular hemorrhage, and acute hemorrhage gastritis. Among those who did not receive anticoagulants, 38, 1.9% patients had bleeding events compared to 24, 3% among those who received anticoagulants. P equals 0.2. We are hopeful that this report of the association of anticoagulation therapy with improved survival will be confirmed in future investigations. Cardiologists on the scene who have been on service caring for COVID-19 patients for the last 3 weeks. I have observed an increased amount of blood clot cases among hospital patients, so it is critical to look at whether anticoagulants provide benefits for them. It is important to note that further analysis and prospective studies are required to determine the effectiveness for widespread use of anticoagulants in hospitalized COVID-19 patients. This study is opening the door for a more extensive study that will be carried out with 5,000 COVID-19 positive patients, where we will evaluate the effectiveness of 3 types of antithrombotic therapy: oral antithrombotic, subcutaneous heparin, and intravenous heparin, and then prepare and gauge our data for prospective clinical trials. Researchers are excited about these preliminary results that may have a positive impact on COVID-19 patients and potentially give them a greater chance of survival, although more studies are needed. Good day, this is Professor Will, CBMD PhD on infectious disease and microbiology. Well, hope everybody's having a great day. Hope you enjoyed listening. Take care.